have been contacting different social workers from our department since last, I believe, Thursday, yes.
Okay.
And then I haven't heard anyone back except Dr. Sarkar this morning.
Yeah.
Then he said he has been really sick.
Oh.
So he's sorry for the late response. And then I said that was totally okay as long as we can still conduct an interview today. So he said after 3:30.
Yeah.
But then here I am. Don't see any response from him. But it's okay. I have you now. But
people are a lot on the ground also because in addition, so if they're not teaching, like for example, if I don't teach today, I go and do research on other days. So it can be difficult, challenging to catch people.
Yeah. So it's I learned that the hard way. So in the future, if I want to interview someone, I should like contact them a month earlier. Okay, so my topic that I chose for my annotated bibliography is on homelessness, the relationship or the association between homelessness and child abuse.
Yeah.
And so I found 5 links. Okay, I'll ask you on that later. Let's first focus on this. So can you tell me like what have you come through to get to where you are today in the career of social work? Like I know you talked about this in class, but let's do it again.
So I don't have a BSW. I have a bachelor's in world history. So that's what I majored in my undergraduate studies, and I did that back in India. Then I worked for the United Nations for 2 years, where I was working on issues on child labor, domestic workers' rights, construction workers, all informal workers, and looking at how international conventions and international laws are implemented in India. Once I finished that, I was working on the side of that. I was working on a master's for social work in India at that point of time, and then I applied to Boston College to do my master's there because they focus on global social work, and it looks at local policies and international policies and more program basis, not direct practice. So I applied there. So I moved from India to Boston. I completed my MSW there. Then I worked for a couple of different organizations. I was working as part of a lobbying firm in Boston. So they were mostly looking at state legislations, focusing on nurses, access to healthcare, access to basic needs for low-income populations mostly. So going in and lobbying for those things. Then moved to Rhode Island, worked for Plan International, which is again an international organization, where I was looking at marketing and looking at mostly branding of this campaign called Because I'm a Girl campaign, which was looking at adolescent girls and their access to education, healthcare, early marriage issues, early pregnancy issues, so stuff like that. Then I moved back to Boston for my PhD. So I got my PhD 2012, and then really was focusing on access to food and nutrition. So that's been and I go every year. I was going back to India, working there as well. So every summer I used to go back for 4 months, where I continued to do projects in India. So it was looking at accessibility to food, accessibility to hygiene, sanitation, and how do you work with very low resources, and then but how are you getting good outcomes with those very, very limited resources. So I finished that. Then I moved to Ohio from there, and then I started working for a small nonprofit, which was a mixture of industrial product designers and people who are in criminal justice and people who are in social work type fields. So, and what they do is use product designing methods. So design thinking is something that they use, which is iterative learning for products. So these were all product designers. So they use that to put it into social work. And they said, how do we use the same method of iterative learning to develop programs, not products? So I was doing that. So I was leading their research team for a couple of months. There, teaching classes on cultural competency, looking at research, looking at data analysis, all of those things, and then finally moved to Seattle last July.
Oh, she's like less than a year.
Yeah,
Oh.
yeah.
Welcome to Seattle.
Thank you. So yeah, and then I'm here in academia.
Okay.
Yeah.
So for the past less than a year in Seattle, so outside of working as an instructor at Seattle University, what other social work organization are you involved currently?
So, couple of different ones. So the track that I'm on, so I'm very, very similar to Shanjani spoke today about Emilia, Dr. Dur, who works, who's a tenure track faculty. So it's the same. I'm also a tenure track faculty, which means I need to be doing research, I need to be teaching, and I need to be doing community work. So those are three different things that is within my profile of work that I do. So in addition to teaching, I work with ACRS, which is Asian Council Referral Services.
Yes.
So I work with them. I'm doing their, I've just started working on their Southeast Asian Young Men's Group. So I work with evaluating that program. It's one of the things that I'm doing.
What's the program again?
It's called Southeast Asian Young Men's Group. So it's a middle school and a high school group of Southeast Asian boys.
Okay.
And trying to see how their knowledge about the countries that they come from, how are they looking at acculturation within Seattle, within the US, how are they talking about like personal well-being, what is the education looking like. So there's a curriculum that ACRS develops, and then they needed an evaluator, so I'm doing the evaluation for that. So that's one. Then we're working with Capitol Hill Housing, which is right here. So that's another project that I work with. Is again evaluation based, so seeing how are you improving the effectiveness of the program there. So that is another project which is within Seattle. Then I continue to work in Boston with my advisors there. So we're working on more of research work. So more of doing looking at foster care youth and looking at their school outcomes, and then trying to write work within that. Then I continue to work in India, where I'm working on. Yeah, that's a lot of fun though.
Yeah.
So
But you're working at so many things at once.
Yes. So in India, we're working on again a nutrition program. So I try to go in once a year during the summer. And then go and at least implement the project, and then come back and then do the analysis here. So currently I'm working on a domestic workers project, which is looking at India has a lot of people who are working, who are migrating from low income communities, so rural areas, and then they're coming to more urban areas, but they're coming in as domestic workers or domestic help. And then what we're trying to look at is their stories and how are they getting support or lack of support from, say, community, from the police, from all the landlords, from what is their accessibility to well-being look like. So that's one of the projects. Yeah, I'm trying to think if there's other stuff. And then the Ohio project, I continue. So the same place that I used to work on originally for consulting. So working with them on something also. So a bunch of stuff.
So, okay, so since you're doing so many tasks at once, I have one question is, what's your inspiration what's the inspiration that drive you to social work? Like, and when was did you know that you want to pursue the career in social work?
So it wasn't social work specific. Like again, social work, like I said it in class, is very, very broad for me. It's not only clinical practice. It can encompass economists. It can be looking at people who are working on technology. It can be business. It can be micro enterprise. Whatever. Anything that is driving change in the community would be considered as social work. And my entire family is in some way connected to social work. So my great grandfather, from my dad's side, was a freedom fighter during the Indian independence. My mom's side, my grandfather was surgeon. He was a civil surgeon, but he was working in rural communities and trying to give them access to healthcare. My mom's a child psychologist. My dad's an economist who works in trade union. My sister's also working in mostly labor rights and media. She does that. Now my husband's side of the family also does. My dad, my father-in-law, he used to work for non-profits and mostly financial side of non-profits. Mother-in-law is a pediatrician. So everybody around me has always been a part of changing society in some way. Not particularly social work, but so that's always been a part of life. So I think that was the inspiration. But social work specific, I like it because it's very, very broad. And you can do a lot with it. So I don't consider myself as a very US-based clinical social worker. A lot of my work is very interdisciplinary. So if you see my work, it'll be a lot of economics coming in, a lot of business coming in, a lot of innovation, so a lot of innovative technology side coming in, and then social work side also. So it's a lot of different stuff.
Okay. So wow, I can check multiple so far. Okay. This one is a hard one. What ethical dilemmas have you faced, and how? Just that
ethical
part.
Dilemmas.
Yes.
I feel like number one is when I used to work for, mostly because I don't do direct practice, I do a lot of programmatic development, so very macro type work. When we had to write reports for international organizations, because you have to provide, say, a report saying this is what we accomplished and our funding is based on that. The cycle of funding is based on that. So there was always a dilemma of whether you tell the full truth of that the project did not work and you would get funding cut from the international organization because you didn't do enough work because of the challenges, or do you kind of change the truth a little bit so that you can continue to get funding from different. So I think, like, at least in India, and now continue to, how do you connect with funders, because a lot of our work is connected with funders and funders always want to see success, but it's not necessary that when you're implementing something there'll always be success, because there's so many challenges and there's human beings that you're working with, there's politics that you're working with. So I think that is one major dilemma, is how much truth do you say as a local grassroots organization who is trying to do but has so many challenges and might get funding cut. So that's one. And then I guess deciding when you have laws on one hand but you have reality on the other. So how much do you follow and where do you take a call of not to follow? What would be ways that you can get by? Because policies aren't necessarily made with human reality in mind.
Oh yeah. Okay. That one. So how do you practice self-care? Before we get to that, let's say, what do you think is the essential skill for getting into social work and Like, yeah.
No, I feel like for me it's very different because whenever
For you.
so I have a lot of friends who are of course social workers, and a lot of them have been trained in the US, and a lot of them do clinical work. So for training for them I feel like it looks very different for me as somebody who's been essentially brought up in another country, where social work looks very different. So social work there is very, very community, it's very interdisciplinary. So for me, essential skill would be really having knowledge of all different pieces. So you can't provide a service to somebody without knowing politics or policies. You can't provide service without knowing business, because you need to run a non-profit, or you need to know how to develop budgets, how to work with financial statements, all of those pieces, or how do businesses work. You have to be very rooted in reality also, and knowing that there is politics involved, there is human realities, there is corruption. So just being very grounded in reality, I think, for me is what is important.
Great. And then how do you practice self-care?
Oh goodness. I think
Yeah, I see you're very busy with all those multiple tasks at once.
I love it. Like I think it's something that I'm naturally a person who loves to be busy. So I think, and I'm fortunate enough that I'm in a family that also loves to be very busy. So A is that I need to find something that's interesting to me. So if I'm working on projects, it has to be something that's interesting to me. Otherwise, I get bored very easily. So finding that place of passion is very interesting for me. Second is family. Family and my very, very close-knit friends are very, very important to me. So even if like half of my family stays back in India still, but still continuing to have that link of conversation, of like being able to debrief with them of, oh, this was my day, this is what it looked like, etc., etc. So that's another very important piece. Then I think I dance. I'm a professional dancer. So that is something that's important to me on the other side. So I make sure that I continue to do that. So that's a place where I don't think about social work. I just go and do my dance.
Great.
Traveling, very, very important. Once a year, going back home to India, spending time with my parents, or spending time with my husband and I every weekend. We're trying to do a different business because he's from the business background. I'm from social work, so we try and find ways that we can develop different things together.
Yeah.
So whether it's a business, whether it's a non-profit idea or something, so just constantly through.
I see. So the basic idea is just like to still separate work from life, and then still...
I find it difficult because my entire life is surrounded by, even my father, if I talk to him, he's constantly traveling, he's constantly working on the same topics. My mom is a teacher, so I feel like I can't separate myself from my like social work, like social change is a part of our life. So it's very difficult for me to say, okay, today I'm not going to talk about it, because I talk about it all the time, and it's fine because you get to talk and debrief with family or with friends who get it, and or people who just want to have a conversation. But that does not mean that you're constantly talking about work, right? You can talk about other things. You can go enjoy the weather. So I try, like, after 6 o'clock, 7 o'clock, go back home. Let's do something else, like let's cook. Let's watch something, let's watch shows, let's do something that's not work related.
Okay. Okay. This question is interesting. Is there future employment in your field? Obviously, because as long as there's need, then we always need social workers.
Yep.
That I know. So what's the average salary? Am I supposed to ask this?
It's up to, I mean, average salary I think would vary a lot. Like you don't,
because it's a very broad field.
exactly. So I mean, if today I say if I want to work for, say, a big international organization and I want to work for them, and my say Bill and Melinda Gates I want to work for, and the salary will look very different versus I go and work for a very small non-profit organization. So I think average salary would really depend on what you choose to do in social work.
Yeah, I see. Okay, I think I got it all.
That's great.
Yes. Wait, so let's backtrack. I have some question outside of the interview.
Yeah.
I was trying to ask you about my annotated bibliography.
Yes.
So I see that you said two of the sources must be descriptive. That is to clarify the social issue that you are that is the topic of your paper.
Yeah.
And also the other two sources that must be prospective. That is to provide the solution to that issue. But then when I find that, so my topic is about the association between homelessness and child abuse, and foster care is also one of the solution where because to provide a better education and help in physical and mental for those kids that don't live in very good condition. And then, but then it brought up like a very different topic because so I'm not sure how to put both in under the my paper. I can, but then it feels like I'm bringing two different topics into my paper. So is that okay? Is that what the intention that you want on that?
So for the first piece, when you're describing your social issue, you would get in one, find like any place that gives you a clear definition of your topic area, right?
Yeah.
So if you go to Encyclopedia of Social Work or something, you would get like this is what your topic area is, and then you include a citation for that. For the two citations that you have to include, it doesn't have to be that this is a solution and this is the person who came up with the solution. But if you talk about, say, we need to take into consideration that we need to keep in mind the social structures, intersectionality, take care of all the different systems within the community when we're coming up with the solution. One of your main readings had that in it, which was a theory. So you can just include that citation. So that could be another way rather than like trying to tackle a whole different topic. The method of coming up with the solution could also be a citation.
Yes.
Does that make sense?
Yeah. Okay. All right. I think I get that. All right. So for the SNAP assignment.
Yeah.
So I have a couple of questions that I want to ask you because so for the price of housing, I do have a. Did you see my notes in each cells? Because I have a lot of notes for the price that I came up with.
Should have seen it. I've graded that one already.
Yes.
Yeah.
A while ago, but I never remembered to ask you about that.
Yeah.
So I see your question and I just want to clarify some points.
Yeah, let me open it up so I know what you're talking about.
Yeah. And also, you asked me how about tax, but I actually included tax after all the prices, but I just forgot to put them in the cells.
Okay, here. Yeah, so miscellaneous, in this I was just asking you what does it include when you say miscellaneous Like, tell
Yes.
me what you mean by miscellaneous.
And so personally, I wasn't sure, but according to a self-sufficient budget, I found from Seattle. I forgot about that, but it says it had that number for me.
Okay.
But yeah, I can't really explain that.
Okay.
And for this, for the original version that I sent to you, there's a really long comment that includes
This
everything.
I have this one.
Oh, it doesn't look like.
No, this is what it came in as, and then this.
So this one looks.
This looks fine.
Yeah, but the other two, it looks
Yeah.
different from what I submitted. So okay.
Do me a favor, just send it to me as an email. If you included a full explanation of it, because this is all I got in the.
That's why.
I didn't get an extended explanation. That's why I'd asked for an explanation. Let me see what I wrote.
Yeah, let's take a look.
Yeah, so I didn't get any sources here. That's why your points were cut here. That's it. So there was no other points. I didn't cut points for meal plan or for your reflection of a quality of work. The only one that your points were cut off for because there was no sources provided.
So, do you mind if I send you?
Yeah,
right
just send it to me. Yeah, I think the recording is